Dr. Kahan, what is all this basically heel spur pain all about? And are there different type of heel spur pains? Explain it to us, because I'm not so sure when people say, when they hear advertising heel spur, fixed and whatever, laser, I'm not even sure that most of us know with which symptom to match it with.
You kind of blacked out for a second there on some of the audio, but what I think you're asking is how can heel pain present itself, and basically how can people recognize whether they have a potentially serious problem or not.
Right.
Typical
which
scenario.
Which pain in the foot qualifies as heel spur, and what can be done to fix it? Or maybe even,
Gotcha.
if there can be, what can be done to potentially prevent it?
Correct, exactly. The number one symptom of heel pain is usually you wake up in the morning, you step down on the floor, and the first thing you want to say are not very nice words. And the pain is in your heel or in your arch. That is the very, very telltale sign that there's either a problem directly in the heel or in the arch of the foot. And we could be dealing with a heel spur or a term which people have probably heard called plantar fasciitis, more or less an inflammation of the arch of the foot. 90% of the time or greater, the problem presents in the heel, in the arch. Sometimes people can get pain on the outside of the foot. A little more uncommon, but that is typically caused by a referred pain from the bottom of the foot. You get pain on the outside of the foot. Again, called referred pain. Pain on the bottom of the foot, whether it's the arch or heel, obviously is not normal. If it persists longer than a week, 10 days, it needs to be treated. A number of different ways to treat. Very conservatively treated. Heals 90% of the time. Proper shoe gear is very important. Instantly acting on the fact that pain, you need ice pain. Ice and pain. I don't know who invented ice, but what a great invention. It's cured. It's helped many, many conditions. Heel pain, a tremendously painful problem. Unfortunately, it can take months to resolve, even though you feel like it came on overnight. Conservatively treated typically does very well, and there's a number of modalities and treatment options available for people with heel and arch pain. Let me know if that answers your question.
It does. Now, what are some of those treatments, like those conservative treatments, and also shed some light on what are the more aggressive treatment or the surgical type of treatment? Kind of explain it to us a little bit in a very short umbrella way.
Absolutely. I always tell people, and I tell my office staff, if somebody's coming in for heel pain, bring their shoes in. I don't care if they bring in a bag, a hefty, a 33-gallon hefty bag full of shoes. I'm going to look at the shoes they wear the most, and we're going to start with something simple. Are you wearing the right shoe gear? Are they giving you the proper support, et cetera? Do you need some kind of an insert in your shoe? From that, we go on to conservative care, which can be anything from specific types of athletic taping on the foot, which we do in the office, and I can oftentimes teach the patient how to do that at home. There's splinting, night splints that people can wear while they're sleeping at night to help stretch the plantar fascia of the foot, the supporting structure of the bottom of the foot. Cortisone is a very, very viable, frequently used option, as well as if people are afraid of having a cortisone shot, there's nothing wrong with a very short-term course of cortisone pills that you can take. They're very effective. Not 99.9% of the time, people don't have to worry about side effects, things of that nature. And if conservative means fail, which oftentimes they do not, whether it's the taping, strapping, icing, splinting, injections, we also utilize laser therapy in the office, which is a fairly new type of treatment, which is phenomenal. It's a great adjunct to the conservative care. And worst case scenario, 10-15% where patients have to go for a surgical correction. The surgery has advanced tremendously over the past few years where We all have friends that have had to go get their knees fixed or their knees scoped. Well, guess what? Now you can have your heels scoped just the same way. And the recovery time is is so much quicker than in the old days. 20 years ago, we'll call the old days. But you could be back at your regular activity in a matter of a few weeks. Technology is great. Treatment options have progressed quite rapidly for heel and arch pain.
I see. So some of that surgery for the heel spur does take, you go to the hospital, you say back in a few weeks. Is the surgery done outpatients and the patient gets back, he just cannot quite walk for a little while? Or is he actually like with a hip operation in the hospital? What's the deal?
No, it's an outpatient type surgery. You're in the morning or afternoon, you're home that same day. Very few procedures that we do anyways for most foot or ankle conditions are require anything more than just an outpatient type surgical situation. And oftentimes, depending on how bad the problem is, a couple of weeks, you're off your feet or using crutches or maybe even a walking boot, something as simple as a walking boot. Rarely are you casted or have to be in a fiberglass cast. And we want people typically with heel spur surgery to get back up and start getting stretching, physical therapy as quick as you can.
Great. Well, it looks to me like from what you mentioned on the non-invasive cures, you're starting off with the shoes and maybe some orthotics and maybe some splints and stretching the foot in a certain way at night. It looks that all that is something which was neglected for a bunch of years why the situation in the first place came. So if a person goes to a podiatrist, maybe not quite as often as to a dentist, but goes to a podiatrist regularly from young on, perhaps is it possible that you guys can see what's going on and then you can actually say, look, you need inserts, you need this, you need that, and when you're 40 or 50, you might never know I helped you because you simply don't get a heel spur problem. Is that a possibility?
Excellent point, Helmut. It's kind of like, if you don't take care of your car, you don't get the oil changed, the shocks changed, and so on. What do? You go through tires. The car doesn't function as well. Well, people neglect. We forget about our feet. If we don't have pain somewhere or a problem, we just ignore it and go on about our days. We're a reactive society, and we need to be more proactive and start taking care of things beforehand. I'll get phone calls in the office that my staff will relay to me of a patient who has arch pain, et cetera, et cetera. They're afraid to come in. I will call them. We'll discuss the problem. Whether it's, I'll tell them to come in. Let me look at your shoes. Come on in. I will inspect your shoes before we do anything. I don't want to scare you to death about how we treat this or not treat this, but something as simple as a shoe change can oftentimes result in just a 100% cure for their condition. And they think, oh my God, how silly am I that I didn't realize I was wearing the wrong shoes, or I didn't have the proper insert, or that my right foot was a half inch longer than my leg was a half inch longer than my left. Simple things that you just don't think about.
Right. Well, it's difficult to kind of think that when you go to the store, JCPenney, and nothing against JCPenney, and you buy a $120 pair of shoes, that they might not be very healthy. I mean, you figure everybody has your best interest in mind, and they do, but for their reason. Do you understand?
Absolutely.
It's a little bit, if I make a Ferrari, I have your best interest in mind if you want to look good and be fast and whatever, but not if you're a farmer. It's not. So we have all, and I guess getting that help from the podiatrist seems to be, it becomes a way. I become aware that actually that's a good thing to go in and get checked out, because it doesn't look like a lot. It's just you go there and it's almost like a consultant. You tell us what to do, and then we avoid problems down the road.
Yeah, exactly. From the patient sitting in the chair, which we can obviously tell a number of potential problems, to watching them walk down our hallway. That's why there's probably not a podiatrist's office in the country that doesn't have at least a 40 or 50 foot long hallway, and it's for one reason. It's not because we want a long distance between the front office and the bathroom. It's because we want to be able to watch people walk. We want to see how their gait is. Are their hips tilting? Are their shoulders off balance? Are their knees pointing straight? Do the feet go this way or that way? We can tell so much just by watching them walk. And that's our specialized training. That's what we're trained to do.
Wonderful. Thank you very much, Dr. Kahan.